Hi guys, today we're going to be doing a Halo BBL treatment for the face. For those of you who saw my other video on Halo BBL for hand rejuvenation, I mostly talked about how the Halo works in your skin and how the BBL works. Today we're going to go more into why we're using it for our specific patient and what her concerns are, and then we'll demonstrate a treatment too. So our patient's name is Angel, and she takes great care of her skin. She uses all the best skincare. She uses our Skin Medica products, our ZO line and Skin Benefit. She gets Botox regularly, filler occasionally, and wears sunscreen every day. But even your patients that take the best care of their skin need a little boost every now and then. So that's where lasers can come into play. They're that next level treatment where Botox and filler and skincare can't fix everything and can't prevent all aging. So we'll go back in the treatment room in a second and we'll look at Angel's face, but her main concerns are sun damage. She's been out in the sun a lot, even though she wears sunscreen, and just general texture of her skin. So the BBL portion of our treatment will work on pigmentation. It helps with sun damage, redness, broken blood vessels, and it will overall increase her collagen production. The Halo portion works more on the fine lines and wrinkles, skin texture, pores, and it resurfaces the whole top layer of the skin. And it also increases your collagen production. So the combo together will really clean up her whole surface, improve her complexion, and decrease some of those fine lines and wrinkles. So the overall downtime of Halo BBL is only about 5 to 7 days, which in the grand scheme of things when you're talking about lasers is pretty short. So that's one of the reasons the Halo is so popular, because it's a low downtime ablative laser. Even after those 5 to 7 days are over and your skin's back to normal, you still don't see your full result for about 90 days or 3 months. And that's because that collagen production that we talked about continues to ramp up over those 90 days. So at the end of those 3 months, you see your full resurfacing result along with the collagen production. During those 5 to 7 days of downtime, I really touch on 3 things that you're going to notice. The first one being swelling. There's a lot of swelling with this procedure, and that's just because of the heat involved. It's short-lived, comes down over the 5 to 7 days, with the first few days being the worst. Second thing you'll notice is redness, and with the third being a rough texture to the skin that will kind of feel like sandpaper, and it expresses itself off the skin during those 5 to 7 days. During our treatment, we will use Pronox for her discomfort, because you'll feel a lot of that heat during the treatment. And then when she leaves, we'll send her home with a water spray that's really soothing on the skin. And I always recommend having a little hand fan with you for this recovery, because even though your heat from the laser only lasts about 3 or 4 hours after the treatment, it can be pretty intense. And speaking from personal experience, I wasn't going anywhere without my fan for those 3 hours until that heat really dissipated. Once the heat goes away though, there's no more pain. During the rest of your recovery, it's just kind of being patient and waiting for that swelling and redness to come down. So the treatment time for Halo and BBL, she'll probably be with me about an hour to an hour and a half for the total time. But yeah, that's it. We'll go ahead and get started.
Okay, so we've got Angel's face cleaned off, where we can kind of see all of the main things that we're trying to address today. So if you zoom in a little bit, you'll see some broken blood vessels across her cheeks and her chin, a little bit of brown pigmentation. She doesn't have a whole lot, but you'll notice that some of that gets darker initially from the treatment as it sheds. And then just general texture. Her upper lip is always an area we treat with Botox, and so I know that's a main concern. And then just general pores across her face too, but we'll treat her whole face, jawline up to forehead. Yeah, and just kind of address those main concerns. First couple are usually not that bad, but they get hotter just as we accumulate and go over the area a couple passes. We'll do a couple passes for redness first, and we'll do browns, and then spot treatments and broken blood vessels. And we'll give her a short break between the BBL and Halo before we get going on that part of the treatment. And this is just an ultrasound gel that serves as a barrier between the crystal from the BBL and her skin. And it kind of helps you to see where we've already treated. Put some eye shades on you real quick. You can go ahead and start breathing on that Pronox if you want to. Thank you. There you go. Take a couple deep breaths. How's that feel? Okay. mouth real quick and roll your lips in like you're hiding them from me.
So right now we're in between our BBL and Halo. We're done with the BBL. So BBL doesn't actually break the skin. This treatment by itself, she could wear makeup right after, but since we add the Halo, she's got a little more downtime. So if you look at her face, she's just a little red. You can have some swelling with BBL by itself, but the combination is really where you get a lot more swelling, just with the heat kind of doubled up. But yeah, this wouldn't have as much downtime if she did this alone just for the pigmentation, but we'll show you again what she looks like right after the Halo so you can see what both look like. And you can see, I don't know if you noticed the blood vessels on her chin before, but those have already decreased a lot and they'll get better. The rest of your result will be more of it at a week to 2 weeks. So we're starting our Halo portion of the treatment, and I just wanted to show what we're going to send her home with. This is the water spray that I mentioned, so it's just a sterile water that's going to feel really nice and it's kind of chilled. And then Sickle Fate is what she's going to put on her face as kind of her moisturizer barrier and just to help with some of that roughness and dryness. And she can use this for the full week that she's recovering. She can put makeup on after 48 hours, but it's not going to hide much of her downtime. Most of what you notice is the swelling, so that's just kind of up to her if she wants to use it. But we've got her breathing on her Pronox, because this is the part that'll be a little bit hotter. And then we'll get going. Okay, I'm gonna turn my machine on over here. Okay, Angel, here we go.
You're doing good.
The forehead's pretty sensitive. That hairline can be pretty sensitive. The white dots you're seeing, that's the erbia. That's the ablative part of the laser. And that will go away as soon as I spray her with that sterile water. You're doing good, Angel.
Do a quick spray.
Okay, so we just got done with the Halo part. That part's a little bit more intense. We've got this fan. This is just shooting out cold air going on her right now. And then she's got a hand fan in her purse to take home with her, along with this spray that I'm just kind of spraying her down with to make it cool off. You can see a little bit of pinpoint bleeding, and she can wash all that off tonight or tomorrow morning. And then she'll apply her Sickle Fate in the morning as well. And then we'll follow her throughout her recovery, and she'll be good to go in a week.